COPD is chronic obstructive pulmonary disease, and it is a pathological condition that includes emphysema and chronic bronchitis. These disorders have overlapping features, and because patients often have characteristics of more than one disorder, both are classified under COPD. Hi, good morning, Mrs. Stewart. My name's Meredith. I'm going to be your nurse today.
Okay.
Could you please give me your name and birthday?
Martha Stewart, 11/2/1945.
All right, awesome. So what brings you in today, Mrs. Stewart?
I've been having a really bad shortness of breath.
Okay, so when did you start experiencing your shortness of breath?
It's been a really long time. I can't remember when it started, but lately it's been really bad.
Okay, so what makes your shortness of breath worse?
It seems to get worse when I walk my dog.
Okay, and other than your shortness of breath when you exercise, right?
Mm-hmm.
Are you experiencing any other symptoms?
Yeah, this cough, it's like a dry, weird cough.
Okay, and it won't go away?
No.
Okay. What about your history of respiratory infections? Have you had any?
I don't have any.
You don't have a history of respiratory infections?
Mm-mm.
What about recently? Have you lost any weight? Any recent weight loss?
I don't weigh myself. I don't like to do that. But
Right.
I have noticed that my clothes fit a little looser.
Okay, and what about smoking? Are you a smoker, Mrs. Stewart?
I've been smoking since I was 14.
All right. And about how many packs a day would you say you smoke?
I smoke a lot, like 2 packs a day. I need one right now.
All right, Mrs. Stewart, I'm going to start your exam, okay?
Okay.
Okay, I'm just taking a look. All right. Upon entering the room, I noticed that Mrs. Stewart was sitting in the tripod position. People who have COPD often sit in this position where they're leaning forward with their arms braced against their knees, the chair, or a bed. This gives them leverage, so the abdominal, intercostal, and neck muscles can all aid in their expiration. With a normal chest, the anterior-posterior AP diameter should be less than the transverse diameter. The ratio of the AP to transverse diameter should be a ratio of about 1 to 2. But in people who have COPD, this is abnormal. And in Mrs. Stewart, I saw that she had a barrel chest. Basically, the ratio was about even, and her ribs were horizontal, and her chest appeared like it was in continuous inspiration. Mrs. Stewart, I'm going to place my hand over your back, and whenever I do, I'm going to have you say 99, okay?
Okay.
Go ahead and say 99.
99. 99. 99. 99. 99. 99. 99. 99. All right.
When assessing for tactile or vocal fremitus, fremitus should be a palpable vibration. Sounds are generated from the larynx and are transmitted through the patient bronchi and the lung parenchyma to the chest wall. So I had Mrs. Stewart say 99. Normally, this is symmetrical, and the vibrations should feel the same in the corresponding area on each side. As for when I did Mrs. Stewart's assessment, she had decreased fremitus, and I couldn't feel the vibrations as strongly as I should have been able to because of the excess air in her lungs that is along with COPD. All right, Mrs. Stewart, I'm going to look at and feel your chest, okay?
Mm-hmm.
Normally, when palpating, you shouldn't feel any lesions, masses, or crepitus. When it came to Mrs. Stewart's examination, I felt crepitus as she breathed due to her emphysema. All right, Mrs. Stewart, next I'm going to tap on your chest and listen to the sound it makes, okay?
Okay.
All right, now I'm going to do the same thing to your back, all right? On normal percussion, resonance is heard, which is a low-pitched, clear, hollow sound that predominates in healthy lung tissue. In the case of Mrs. Stewart, I heard hyperresonance, which is a lower-pitched, booming sound found when too much air is present, as in emphysema. All right, Mrs. Stewart, I'm going to take a listen to your lungs, okay?
Okay.
All right, can you take a deep breath? All right, I'm going to listen around back, all right? Take a deep breath. So normally when listening to healthy lungs, you'd expect to hear 3 sounds that are normal: bronchial, bronchiovesicular, and vesicular. But in emphysema, as a result of loss of elasticity in the lung fibers and a decreased force of inspired air, the lungs are already hyperinflated, so the inhaled air does not make as much noise. Normally there should be no adventitious sounds, but in the case of Mrs. Stewart, I was able to hear wheezing due to her emphysema. All right, Mrs. Stewart, so based on my findings on your chest examination, it appears that you have COPD, specifically emphysema.
What are those?
So COPD is chronic obstructive pulmonary disease, and emphysema is a form of COPD. So basically, you're having a difficulty breathing due to an obstruction in your lungs, and you're having a hard time getting the air out of your lungs. Do you ever feel like you have a hard time breathing out air? So
Are you sure? Are you sure that's what I have?
So your clinical features confirm a diagnosis from the exam that I performed on you, but the doctor will order for a further test to confirm the diagnosis. So you'll have a chest x-ray done to see the shape of your lungs and a pulmonary function test. That'll measure the amount of air that you expire or that you're able to breathe out.
How did this happen? How did I get this?
Well, you've been smoking since you were 14, and you said you smoke 2 packs a day, and smoking is a major cause of emphysema.
Well, what can I do now?
Well, have you ever considered smoking cessation or cutting back on?
No, but now I am.
Okay, well also I know you said that you had a hard time getting the air out of your lungs, so there's something that you can do called pursed lip breathing. So after you inhale, you can shape your lips like you're blowing out a candle to get all of that air out of their lungs. Do you want to try? So you breathe in.
So there's really no cure for it?
Unfortunately, there's no cure for emphysema, but we can treat it and improve your symptoms. The most important intervention would be your smoking cessation, or cutting back on the amount of cigarettes that you smoke. I can give you some pamphlets with all the information and support that you'll need to quit. The doctor will prescribe a bronchodilator inhaler that will help you breathe more effectively, which will also decrease your shortness of breath. I encourage you to keep active and get your yearly flu vaccine as well.
Okay, I'll think about it.
All right. The patient in our video has emphysema and not chronic bronchitis because she does not present with chronic cough that is productive of phlegm occurring for most days for 3 months or for two or more consecutive years.